Lots of care for the people that were disadvantaged. I'm now a kindergarten teacher, so I'll be nice.
You don't have to be.
I wanted to ask you, friends of ours that live in France have a medical card, and there is a chip on it that has all of their medical information from birth to whatever age they are. That scared me, frankly, because I said to them, well, how do you want the government knowing all of your business from cradle to grave? I believe our country was founded on independence, and I think we can all agree on this, whether you're Democrat or Republican. I think it's important that we have privacy between our doctor and our health records, and it shouldn't be shared with the government.
Governor Dean?
And if you could tell me under what moral jurisdiction the Constitution allows you to do that.
First of all, since this is the last one, let me thank all of you on both sides. I happen to think I think everybody actually behaved pretty well. This is kind of a spirited American tradition, and I appreciate it, and I thank you very, very much, all of you. Secondly, the interesting thing about this is one of the biggest problems in medicine was just raised in the last question. It's sort of like the psychiatry patient asking the really tough one on their way out the door so nobody can deal with it. This is a huge issue, and it's much more than about just this healthcare bill, because this isn't just about healthcare. You don't want the government knowing all your health information. You're not so crazy about having the insurance industry or your bank knowing all your information either, which then gets sent to all these credit card companies, and that's why you get all this junk mail. So this is a much bigger issue than healthcare, and healthcare is a pretty big issue. Here's what folks are struggling with, and I don't think one's cooked, and I'm going to give, of course, Jim the last word, but we want to have records that are complete, and patients get cared for better if the doctor who's taking care of them know that it's complete. And so the president put in a lot of money in the stimulus package to advance medical records, so that if you get sick in some place that's 1,000 miles from your home, you can get, if you have the chip, you can carry the records with you. They can stick it in a computer. They can know all your situations. If you've been in a terrible car accident and you can't tell them anything, you have that. The doctor has the information. They know if you're on some kind of medication, etc. That's important. So what guards are there against the privacy? And the guards are a bill that was passed about 6 or 8 years ago called HIPAA, which stands for God knows what, but it has something to do with health insurance and privacy. The problem is it's not enough. And there is no way it's enough. And this is a private sector problem as well as a government problem. Look, just the other day, there was some guy hacked into some credit card companies and stole 130 million credit card numbers. Those are our credit card information that's now in some crook's hands. So there is no really good answer to this, because in this information age, there's going to be, and there already is, more information available than most of us, at least in my generation, didn't grow up on Facebook, would ever be comfortable in having in other people's hands. On the other hand, the more information that your healthcare professionals have, the better it is. So the key is, how are we, and this is an open question, because I don't think anybody knows the right answer to this. How are we going to build a wall between particularly the government, but also corporate America and ourselves, so that our private information stays private, but there are people who need to know our private information, and one of them is the healthcare professional that's taking care of us. So this is a great question, unfortunately, for which there is no perfect answer. So I'm sorry to leave on that kind of a note. Let me thank you again. I've actually enjoyed this, and I hope Jim has too.
Let me conclude where we began by thanking all of you. This is important. And as with every major transformative struggle that our society and economy has gone through, whether it was Social Security of the 1930s, whether it was the civil rights struggles of the 1960s, this should be difficult because it's important. It affects everyone. and we're certainly not going to get it right unless we hear from all sides. So I thank all of you for coming. Thank you for participating, and it was helpful, and it was certainly helpful to me. Thank you. Now, those of you who did not get a chance to ask a question, I'm sorry. I hope that some of the questions that were asked represented what you would have asked had you had the opportunity. Thank you all very much.
Well, that wasn't as bad as it could have been.
That's great.